We are Pro Cannabis Media.
Hi, everyone. Welcome to another edition of In the Weeds with Jimmy Young. And once again, a very special guest joins us. Her name is Alissa Merrill. She is the founder of Flower and Tonic. And I can be perfectly honest about this. Alissa and I are friends. In fact, we've been friends as long as this podcast has existed. Alissa, great to see you.
Thank you. Good to see you too. Not in person, but
that's right.
I love seeing your face.
There you go. Right back at you.
Will do for now.
Let's talk about Flower and Tonic. First of all, explain to the audience that's listening why you started this company and what it is all about.
I came from the pharmaceutical industry, and I was good at selling pharmaceuticals. I loved doing it. I loved working with doctors in Boston, and I sold a lot of Ritalin. And I basically, after having kids, was going back to work. And the day I was coming home from my interview to go back to my old job, I heard about CBD, and I kind of thought it was snake oil. I did a little research and basically just thought more people should know about this. There's science. At the time, I knew someone, a little girl who was struggling, and I felt like people should know about this, and they don't. So I, set out to kind of be that pharmaceutical rep in this cannabis industry. And it's been challenging, but I've really gotten to meet some of the top opinion leaders, and there's some amazing science, but it's kind of the more you know, the less you know.
Well, it's that kind of a plant. I mean, because science and research has kind of dictated the growth of the green wave, and got that politician in Washington, D.C. to sign the Farm Bill a couple of years back. Didn't realize, I don't like to say his name, didn't realize the Pandora's box that he was opening by making hemp a legal crop to be grown in this country, and not recognizing that there are so many cannabinoid, or is that cannabidiols, chemicals inside the cannabis plant that are just now starting to be studied. And again, he opened a Pandora's box, and now everybody thinks, oh, CBD is legal and you can get it in any gas station. And you are of the opinion, as I know, how important testing is of all products that have cannabinoid and cannabidiols in them.
Yeah, like beyond important. I mean, there's no regulation. You have to assume that someone is taking a bottle of olive oil in their basements, pouring it into jars. Like that's what everyone should assume, because it's so unregulated. There's no one's checking. Even, the COAs, which is their certificate, everyone says, make sure you look to see the COA. I could bring in a sample of anything, I could buy a sample of a good product, say Charlotte's Web, people know of, right? I could buy that. I could bring it to the lab with my name on it and get a COA saying it was Alissa Merrill's, it's just not regulated, and people aren't aware of that. So I'm an advocate of it. I definitely think it's such a better alternative to to some pharmaceuticals. I think that it's just a alternative. For someone who doesn't want to put their kid on Xanax right now, I absolutely think it's a smart move. But at the same time, I've seen a lot of problems. There are side effects. Like this industry has not done a good job of sharing, for those people who are using it for medicinal purposes, sharing how to do it properly, so.
And when you say sharing how to do it properly, by the way, your greatest accomplishment is you are indeed the mother of 3 girls.
Yeah.
And just balancing that in the last few months, you all deserve a week's vacation away from your husband and your kids just to focus on yourselves. I just so believe it is such a challenge. I know how challenging it's been over the last few months, so I have tremendous respect for that. But let's get back to your comment about none of us really do know. And because this particular plant interacts with all of our endocannabinoid systems, and every human or every mammal that has an endocannabinoid system, it affects everybody differently because everybody's insides are different. So how in the world do you regulate something like that and test it? Because it seems to me, even if it is the most tested component, it may affect you differently than it's going to affect me.
Absolutely. What you just said, though, like kind of is strange because it's such a, I love a full circle story. But I was just saying to my daughters, I try to like give them kind of I love science tips. Like I never knew I was just a science geek, but I've met all these scientists and they just teach me like, run around your house if you need to focus, like little just sciencey tips. I don't know. And one was that the one thing that every mammal has in common, every single mammal, is fear of the unknown. Like not just fear, but the fear of the unknown is the one thing that we all have in common. I thought that's kind of amazing. And when you mentioned that with the endocannabinoid system, I never really thought of that. But yes, that's exactly, then it's the whole fight or flight. Like it's sad though how little is understood about it. So it can make people angry. It can activate people in ways that they shouldn't be activated. There are products that are categorized as like a CBD, but it might have something called CBG and make someone tired. It's like so complex that when you dive in, it's almost like, do I even want a part of this? Is sometimes how I feel, to be quite honest. But I've really gone on my way to find the exceptional products, and I think that those are worth it.
And on Flower and Tonic, you review the products and recommend certain products, correct?
Yes. Yep. So all the products on the website, we test. I literally buy them like anonymously. Like I don't even tell people I'm testing, because then I am shocked. Like I was the person who I didn't realize that people paid for. I just didn't know pay for play like was a thing. I just was naive on advertising. I had no idea how it all worked. But the better brands, I couldn't understand why they were selling so well, because they just didn't work in my opinion. And, come to find out they're offering like a 40% commission if you're, so I basically just tried to be very authentic. And a lot of the brands, I had to teach them how to do online sales and do affiliate marketing, so I have to say though, the most important thing, I think what I care about most is like that your doctor is going to approve. Like, I think that there's too much like clashing between alternative and traditional medicine. And I'm just tired. Like none of us are doing great, like our health system, like, our everyday chronic care conditions are bad. There are products that potentially help for weight loss, like diabetes and heart disease. So I can say for certain that the message, it's like not, doctors would be irresponsible to recommend a lot of these products right now to patients.
Now that's interesting to me, and I want to talk about doctors without naming specific doctors in this space.
Mm-hmm.
There is definitely a difference of opinion about the amount of dosing, about a total amount of milligrams that is a effective dose for any human. If you look at certain products, you'll see that it has, let's say, 10 milligrams of full spectrum CBD. When I talk to a doctor, they'll say, well, that's great, but it's probably going to be about 1,000 milligrams to be an effective dose. Is that accurate?
No, not at all. Then to be honest, like, you alluded to this before, like I test the products, but then after I tested the products, it was still clear that they weren't all working. So you can have all the correct amount of CBD in the product, but that doesn't mean it's going to work. There's this thing in the pharmaceutical industry called a delivery system that people don't really know about in the cannabis industry. So like there are products that like most of the drinks have no CBD in them. Like they just all stick to the walls of the containers, the plastics erode the products. It's gross. And people they have no clue. They're buying bulk amounts from someone because it's the new hot trend, and they're sticking them in vials and they have no idea what's going on. But I have some pictures that gross you out, of things growing on the outside of bottles, and it's gross. And it can be dangerous, quite frankly. So.
And sure enough, you enlightened me to a lawsuit that's happening north of the border now in Canada, which is where it's legal federally.
Yeah.
And sure enough, there's a lawsuit against some of the biggest manufacturers in the cannabis space. The Tilroys, the Auroras, the Canopies are being named. And you've already enlightened me today, once again, as you always do, about the fact that a lot of these products are in plastic containers. And when plastic interacts with this particular chemical, it screws it up, basically. Is that right?
So the products that actually work better are interacting typically with others. So there's the amount of CBD of the product. There's how it's delivered into the body. You know, like a certain water soluble, like it has to be water soluble to work as a water. You know what I mean? Like most of them are just called one thing and will never deliver anything into your body. But then on top of that, the better products I find are combined with something. So it might be like a CBD and a linolene, which is a terpene. But the linolene, like, you know, the whole vape concern, that was basically because people weren't testing. They test linolene, but they don't know what's going to happen when it's heated. So, you know, that's where vaping, it gets dangerous because some of the pesticides that are perfectly safe to eat eat or drink are toxic when you inhale them. So like, this is the stuff that people are just throwing things together, and then they're having chemical reactions in bottles, and people are buying things with like white crystals growing on the outside. Like it's and disgusting smells. Like you would be horrified. They don't know expiration dates. They just are mixing things. So there are definitely chemical reactions happening. Scientists we're not buying from the scientists. A lot of people are buying from marketing people who do not know what they're doing. So yeah.
And yet, again, with this plant, and again, we're talking about a plant medicine, that produces these chemicals like a CBD, you mentioned CBG, CBN. You really do need a chemistry degree to even understand what these chemicals and this plant does with the human body in interactions. We're all guinea pigs. We're all self-medicating, and we're all using ourselves and our endocannabinoid system as experiments.
Yes. Which is why doctors...
Go ahead.
No, this is why. And that's what I wish, like, I get it. We need it. Like 40% of people can't swallow a pill. Like we need some alternatives. But that's why doctors cannot responsibly, like I used to kind of be, like my thoughts have changed. Like I used to be kind of, how do doctors not, you know, recommend these things? But now I get it. Like the chances of them recommending, how could they recommend a product? They're not testing. They don't know. And it's just unregulated. And it is, but at the same time, Prozac, I'm not necessarily saying that any of those products are safer or better, but at least they're warning people. So I just feel like that has to, first and foremost, I still believe these products are so much safer and so much better, but people just have to be warned, you know?
And be careful and be knowledgeable as much as possible. Read as much as possible. Check out the reviews of the products. Go on Flower and Tonic to see those things. But it is, again, you look at the differences between Western medicine and Eastern medicine, and you know the cannabis plant is right in the middle of this debate, and yet you still have a federal government that is trying its best to limit the amount of research that is being done on this plant. Even though the substance abuse community has researched cannabis for generations, for decades now, and they still can't find really one or two things other than, well, if you do too much of this, it's really going to be bad for you. Duh. I mean, if you drink too much coffee, it's going to be bad for you. If you do too much Coca-Cola, it's going to be bad for you. You know, moderation is one of those things that humans have a challenge with every day, trying to figure out what it is that is the right amount for me and my system. And not allowing the federal government to actually give out grants to researchers is now, sure enough, in the news. There's a Scottsdale Research Institute, I believe, that's suing the federal government, again, to try to get access to more research on the amount of the type of cannabis that's being sold in dispensaries. As a medical card holder in Massachusetts, I trust the fact that when I go to a Rev Clinics or I go to any of the other dispensaries, these products have been tested by our friends at the different labs.
And they have. You should trust those. You should 100% trust those. And I'm sorry, I should have clarified that. Those products I trust, and I'm a huge advocate of people getting their card. It's an opportunity to collect some data to further like the information that we can collect, because you know the dispensaries that you can just look at trends even if you're not getting specific patient information. But no, that's a different ballgame. I think we're talking about I'm talking specifically in this case about the products that are at retail stores, and we'll dive into like the products at the dispensaries, because, you know, oftentimes like, I'm talking to someone like my dad's friend, and he's got a knee pain, and it's just like the same exact story over and over happens. And he's got a knee pain. I recommend a product. He tries it. He loves it. And he's like, oh, I might try a tincture as well. It tries a tincture as well, loves it, and then gets his card, and again, I find more often than not, people have a lot of success and are able to, go off some pharmaceuticals. Right now, like, I don't know, cost wise, like your thoughts, like, in terms of how it compares to what you would be paying for a pharmaceutical?
Well, it's interesting. If you get your little RX card,
Yeah.
there's a discount prescription program when you get to be older, like
Yeah.
your dad and me.
Yep. Yeah.
I'm embracing my OWG status these days.
Yes.
So everything's expensive, but how much is it? How important is it for your health? If I find something, and you mentioned Charlotte's Web, to this day, that is the only CBD full spectrum product that I have ever used that has had a positive effect on me. And I've tried other products that you've recommended, no disrespect. I've tried them.
Yeah.
And you know what? It just doesn't have the same effect as Charlotte's Web had on me. And again, that's me, right?
Yes, and that makes sense. I mean, there's like a genetic, I guess the one thing that really made me decide to leave pharmaceuticals, the pharmaceutical industry, was that there's like all this genetic data available. Like our genetics play a huge role in how we're going to respond. And I don't think the pharmaceutical industry looks at all at that, how your body specifically does with adaptogen versus melatonin. And so there's just so much to learn, though. It's overwhelming. I'm nervous that the industry, like, to your point, some of these bigger companies, they need more scientists, and there are some amazing scientists out there. And it's frustrating because they're not good at selling themselves and trying to sell them, to let people know that they're there. They want to share the information. And that's what, in the end, that's what I'm trying to do. So it's taken me a very long time to launch, this official website with my recommendations, but it is live, and I will be continuing to promote it, but more like with the help of scientists. I really struggle because I don't want to look like I want to be everything that the affiliate blogger, you know what I mean? I want to be opposite of what I am, like in terms of, I don't want to look like all the affiliate bloggers that I'm that are I'm disgusted. And then I'm kind of right next to them. So it's a hard,
you're trying to distinguish yourself from those phonies is really what you're saying.
And I was doing it before COVID. So that was, So before COVID, I decided, you know what, I can't do it online because it's like, it's very hard to be authentic online. I just, no matter what I spent on marketing, I couldn't get myself to make myself look different. So I was working more with like the patient advocacy departments at Dana-Farber and Brigham and Women. And that's like where it gets exciting. The doctors and nurses want to learn, but they wanted to know about side effects before they happened. Like they're hearing about side effects and problems, which are fine. Like they're fine with side effects, that's part of medicine. But they just are unprepared, and it's the way we're approaching it. I think it's disarming, I think, for physicians, to be honest.
Well, I will tell you, I've interviewed a few of those scientists, and I am extremely intimidated by the intelligence factor there, because when it comes to my own personal experience with science, it ended with the dissection of the frog in 10th grade, perfectly honest. What would you like to see in the CBD industry? Obviously, more research, more testing, more regulation?
I think I'd like to see myself removed from the CBD. Like I think the CBD industry has a rap for being snake oil at this point. And it has been. I don't know if it can like pull out of that. And I think a lot of the scientists that I look to are referring to like words like cannabinoid medicine, because, like in the, cannabis, marijuana world, how we say sativa and indica, but that's really like not like, we wish we got away from that, right? Like it doesn't work at all. So like I'm just hoping to separate. Like I don't even want to say CBD anymore, but I think that so my hope is that there's more separation. There's a real medicine, because very soon, like one of my favorite scientists, Mara Gordon from Anselda, she was We the People, the doctor there. She's amazing. And so she's got a product that's in it's in stage 2 clinical trials, very close to being, available for things like insomnia, Parkinson's. I forget the exact indications that were close, but so those same products though can be at a dispensary, and that's where I want to see things going. So more regulated, more science,
research. Yep.
Yeah, and more
Absolutely.
medicine. Yeah.
There you go. Because I will tell you, there's so much information out there. It's one of the reasons why I love doing what I'm doing now is I am fascinated with knowledge. And once you figure out enough just to kind of be intelligent about your buying decisions, sure enough, there's another study that comes along and refutes it, or at least puts a curve in it, and you're back to almost square one again, because there's always going to be more research that has to be done on this amazing plant. It's plant medicine. That's the incredible thing. And when you talk to the scientists and they can explain to you that they can actually dictate the DNA now of the plant, that's so far above my pay scale. I don't even know how to handle stuff like that.
Well, I know, but then you can also simplify it down. Like I like the analogy of like tomatoes. You've got like your green tomato. Like I remember when I saw my first sunburst tomato, you know how now we, like when they were yellow and we thought it was weird, like there are different strains and different, like within each strain, there's different vitamins. Like we'll have that another day, because I love using those analogies. It helps. It's not that confusing, but it is, the more you know, the more educated you'll want to be, I think. And that's what I want people.
The more you know. That sounds like a network theme, perhaps, that perhaps we might be able to get out there. Oh, it's already out there. Anyway, hey, Alissa Merrill, always a pleasure to chit-chat with you. You really are the most knowledgeable person I know in this space. You can be found where?
flowerandtonic.com. There are products that I've tested and recommend. Feel really confident. A lot of people, especially right now, can benefit, from trying some alternatives, even some mindfulness tips, things like that. You can find there.
There you go. That's Alissa Merrill from Flower and Tonic. I'm Jimmy Young, the founder of Pro Cannabis Media. Remember, it's a whole new world of weed out there. Thanks for watching. Thanks for listening to In the Weeds with Jimmy Young.
Weed Talk Now, Weed Talk News, and In the Weeds are all available on most major podcast distributors like iTunes, Spotify, Google Play, and our friends at clnsmedia.com and our flagship, Cannabis.net. So subscribe, share, and like our videos on all the social media networks out there, including LinkedIn, Twitter, Instagram, Facebook, the WeedTube, and YouTube. Weed Talk and In the Weeds are two productions of Pro Cannabis Media supported by Revolutionary Clinics, one of the top medical cannabis dispensaries in the Massachusetts area, now with 3 locations in Greater Boston, 2 in Cambridge, and 1 on Broadway in Somerville. Rev Clinics has a patient-first mission. They will customize your needs as a medical patient with the proper titration and combination of strains, flavors, and products. Rev Clinics, where the patient comes first.
We are Pro Cannabis Media.